Hi, everyone, and welcome to the channel. If you're new here on this channel, we talk about medical topics and lifestyle. In today's video, we are covering lower gastrointestinal signs and symptoms that you must not ignore. And when they happen, you should definitely go and see a healthcare professional. Let's get into the video. So, like I said, when these arise, it's important that you seek medical advice, as it can point to something more serious going on. It might not, but definitely can be pointing in that direction. So, there are so many signs and symptoms that can be vague and can be a result of the simplest thing or the worst thing in the world, like cancer. So, in this video, we are going to learn some super easy ways to remember when it may be serious and when we should seek help from your doctor. Now, the signs and symptoms. Now, the signs and symptoms I'll be covering are based on the national guidelines here in the UK, but I guarantee you that they will be similar worldwide. So if you're experiencing any of them, go see your doctor. As I said, we will be covering lower GI signs and symptoms, which means the latter part of the gastrointestinal tract. So mainly focusing on the latter parts of the small intestine, the large intestine, and the anus and rectum. The signs and symptoms can consist of vague things. So, iron deficiency anemia can be one, abdominal pain another, bleeding from the rectum, weight loss. So, all these things can happen, but we need to structure them. So, for example, a teenage girl on her period can be a bit anemic with some abdominal pain. Does this cause us to panic? Not necessarily, perhaps. So, let's structure it in a very easy way that you won't forget and will then arm yourself with the knowledge you need going forward. The first set is for anyone above the age of 40. So age 40 and above, plus the following. So if you are age 40 and above and are experiencing unexplained weight loss and abdominal pain, then you must speak to your doctor. So it's both of these things. So this doesn't guarantee always that something extremely serious like cancer is happening, but it will prompt your doctor to investigate it properly. We will cover those investigations later on in the video, but essentially they are a combination of a physical exam, blood test, stool test, and perhaps some secondary investigations like a scan or a camera test and endoscope. So, but basically, it's this three-factor picture that must prompt you to seek help. So, above the age of 40, unexplained abdominal pain and unexplained weight loss. Then we have the second set of signs and symptoms. So, this is for anyone above the age of 50. So, the last one was 40 and above. This one is 50 and above. This one is quite easy to remember. If you are above the age of 50 and are having unexplained rectal bleeding, seek help. Simple as that. Might not be cancer, but it might be. A lot of other things can cause this, from the simplest thing like having a hemorrhoid to things like IBD to diverticulitis to cancer. So this needs checking out. So statistics show that the older you get, the higher the chances of developing something like cancer are. And that's why if you are above the age of 50 and have unexplained rectal bleeding, seek help. Go to your GP, go to your family physician, and have a chat with them. Rectal bleeding that's persistent and it's not stopping and it's really making you feel unwell, then obviously common sense must prevail there and you have to go to the hospital. But otherwise, speak to your GP, speak to your family physician, and sort it out. So we went over the red flag signs and symptoms if you're above the age of 40, if you're above the age of 50. Now let's take a step back. Let's go backwards and cover if you are below the age of 50 and are having unexplained rectal bleeding. So we covered above age 50 and rectal bleed. Now let's go below age 50 and rectal bleed. So the things that should prompt you to go and seek help from your doctor is if you are below the age of 50 plus unexplained rectal bleeding plus any of the following. So plus, not all, but plus abdominal pain or change in bowel habit or weight loss or iron deficiency anemia. So this cocktail of signs and symptoms paint a negative picture and it needs to be investigated. It's as simple as that. Might not be cancer, but it might be. And it's better to be on the safe side and rule something out than to rule something in because we might already be late to manage it if we're ruling it in. So it's a three-part picture. So below the age of 50, unexplained rectal bleeding, plus one of the following. So we covered above the age of 40, above the age of 50, below the age of 50, red flag, signs and symptoms surrounding those. And now let's get into if you are above the age of 60. So there's a few factors involved here. If you are aged 60 and over and have changes in your bowel habit or if you have iron deficiency anemia, then you need to seek help. So it's not all three again, but it's simply above the age of 60 plus one of the two. So if you have that, then you have to seek help. Anyone can have a change in bowel habit. So you can eat something bad last week and have diarrhea for a week. But if it's persisting for a few weeks and beyond, then it should be ringing some alarms in your head. And if a blood test picks up that you are maybe iron deficiency anemic, for example, it could mean that you're possibly bleeding from somewhere internally and it needs looking into. So that's that for age 60 and above. Quite simple. So it's over the age of 60 plus one of the following. And then we move on to the last factor. So the last factor doesn't care about age. So the last set of red flag signs and symptoms don't care about age. So if you are any age and are having a rectal or abdominal mass, then again, this means alarm bells. This doesn't mean the end of the world. I myself have seen a lot of rectal masses that just turn out to be hemorrhoids, for example, but it needs review nonetheless. So if you feel a lump or a mass in your abdomen or in your anal region, and if you feel like, for example, you can't push the poo out when you're going to the toilet, or something, it feels like it's in the way, then you must seek help. It's as simple as that. If you have a mass in these two spots, rectal, abdominal, you need to get it checked out. It's really, really as simple as that. So that's pretty much it for the video. These are the signs and symptoms that should ring alarm bells in your mind and cause you to worry to seek help. Most people go to their GPs or family physicians to investigate, where a few things can happen. So you can have a history gets taken, an examination happens, whether it's abdominal or rectal in certain cases. Blood tests are ordered, stool tests are done for potential causes, and finally, the specialist teams can get involved, where you're arranged to have a scan or a camera test up the backside called an endoscope. So please, if you're having any of these signs and symptoms we talked about, then get yourself checked out. Again, these are modeled on the UK guidelines. So this is a strict set of guidelines that we follow. If anybody is presenting with this kind of a picture, with these kinds of red flag symptoms, then we need to urgently get them reviewed and investigate for possible causes. So if you're experiencing anything like this, or in general, if you just don't feel right or anything like that, chat to your doctor, have a word with them, and look into things. Thanks for watching. It's really appreciated. Please leave a comment in the section below, and we will see you in the next video.